Welcome back to WKYT. Kentucky leads the nation in colon cancer cases per 100,000 people, but screening rates have vastly improved in the past few decades.
Joining us now to talk about efforts to continue that screening trend is Dr. Whitney Jones, the founder of the Colon Cancer Prevention Project. So good to see you. Thank you for joining us.
It's great to be here with you guys this morning.
Let's kind of go over why this is so important and how Kentucky's doing when it comes to treating colon cancer.
Well, colon cancer is a very common disease, the second most common cause of cancer death there is. And Kentucky is one of the nation's leaders in colon cancer cases, despite the fact that we've really done a great job over the past 2 decades. We've doubled our screening rates, but we're stuck at about 69%. So we have lots of work to do. And part of that is making sure that people are aware that this is a common disease and options are available to both prevent it by taking out polyps, as well as finding it early when it can be cured.
Let's talk about screening tests for colon cancer. Obviously, the sooner the better, and there is very specific guidance on this.
Right. Well, first of all, remember, if you're having signs or symptoms of colon cancer, you need to go get checked. That'd be rectal bleeding, abdominal pain, unexplained anemia. That's not a screening, that's a diagnostic. But in terms of screening, if you have a high risk because of family history of polyps or colon cancer, you need colonoscopy, and you need to start at 40 or 10 years sooner than your affected family member. But if you're average risk and asymptomatic, there are lots of choices, including colonoscopy, as well as take-home stool tests that you can do in the privacy of your own home. If those are positive, they require a colonoscopy to follow it up. But there's lots of choices, and while we're all home during the pandemic, why not do your screening for colon cancer?
And these are all covered by insurance. I was reading the information you all gave us, so really no cost to you as long as you've got some insurance. And then there are other options even if you don't.
Absolutely. Kentucky is lucky to have the Kentucky Colon Cancer Screening and Prevention Program, where we provide colon cancer screening, including colonoscopies, for anybody who cannot afford it. But this is covered by all insurances, Medicaid, Medicare, and commercial insurances throughout the state of Kentucky.
And when it comes to treating colon cancer, there's a big difference between catching it early and then once it's progressed past a certain stage.
Absolutely. And one of the great things about colon cancer is by finding polyps and removing them, you can actually prevent colon cancer from even happening. But if you find colon cancer in the earlier stages, then it's over 90% beatable with appropriate treatment. And again, that's where we want to be, is on the right side of this disease.
And you mentioned that Kentucky specifically has issues when it comes to people, young people ending up getting colon cancer. That's interesting.
Right. Well, across the world, there's been a dramatic increase in under age 50 colorectal cancer. In fact, the rates compared to the 1970s are almost double or even 4 times as much in rectal cancer, so the last part of the colon. We don't know what this is, but we suspect it's an environmental issue, something we're eating, something in our diet we're getting exposed to. And Kentucky's the 3rd highest rate in the nation for under age 50 colon cancer. That's why it's so critical to know your family history, as well as not ignore the signs or symptoms, as I previously mentioned, even if you're in your 20s or your 30s. And certainly by 45, we're hoping everybody gets their screening. So yeah, heads up on it, be aware. How
much of this is just talking about it and kind of getting it out there so the people, they don't have any kind of stigma when it comes to talking about their colon?
Well, I think that, 25 years ago, no one would talk about colon cancer. I think we've really broken down a lot of those barriers. What we're really struggling with now is how do we reach that 30% of the population in Kentucky that's eligible for colon cancer screening, has insurance coverage, and just hasn't made that decision to get with their doctor. And again, now that there are take-home tests and other options available, in addition to colonoscopy, which is great, we want people to go ahead and take that next step and, let's move Kentucky forward in one of these areas where we really have made great progress as a state.
Again, coloncancerpreventionproject.org for more information. Dr. Jones, thank you so much for talking to us. We appreciate it.
Thank you, guys. Be well.